Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, how one state is treating absenteeism as a public health challenge. Dr. Heidi Schumacher is Associate Professor of Pediatrics at the University of Vermont. Dr. Deanna Haag is a pediatrician at Monarch Maples Pediatrics in Enosburg, Vermont. They talk with Dr. Josh Sharfstein about a new effort for pediatricians to work with families to help their children attend school every day. Let's listen.
Dr. Heidi Schumacher, Dr. Deanna Haag, thank you so much for joining me on Public Health on Call to talk about education and health, specifically how pediatricians can help kids stay in school. I want to start with you, Dr. Schumacher. You have worked both in school systems and in pediatric clinics. I understand that absenteeism is a big challenge, particularly after the pandemic. Many school systems are seeing a lot of kids not showing up to class. Why is this an issue for pediatricians?
Thank you so much, Josh, for having us on. I guess where I would start is that we know that healthy bodies and minds are the foundations of academic success. And we also know that success in school is one of the leading predictors of long-term health and well-being for youth as they grow into adulthood. And so I think both Deanna and I feel pretty passionately about this space because we feel like if we're going to achieve our goals as pediatricians in supporting our patients and communities to thrive, we have to pay attention to and support their academic achievement in a similar way to how we support any other aspect of their life. On the issue of attendance specifically, I think, as you mentioned, we've seen really significant increases in chronic absence, missing lots of school, especially since the pandemic. And so there's a particular acuity to this issue now, which I think is part of why it's gained so much attention.
So where do pediatricians get engaged?
It's a great question. I mean, I think increasingly in the field, we've been really trying to elevate chronic absenteeism or missed school as a pediatric vital sign. So something that indicates that there's perhaps an unmet health or social need, that there's some other thing happening in that young person's life that's preventing them from being able to get to school every day. Are there family factors, community factors, or are there issues specific to the school experience for that young people where we may be an additional trusted adult, someone whom the family has known, especially in our rural communities, with Dr. Haag is a great example here. Pediatricians can play a role in both promotion, prevention, response, and anywhere in between.
You said that some of the reasons kids are absent might relate to the school setting. What are those and how can pediatricians help?
The more traditional things that people might think of in this space, health or social reasons that kids can't physically get to school or don't feel comfortable getting to school. But there's also things like disengagement. So that young person may just feel maybe like their engagement in school doesn't matter to them. They don't feel like it feels relevant to their future. This is especially the case if, say, a caregiver, a parent, a grandparent, an auntie didn't have a good experience in school. It's hard to really have that young person feel like it matters for them to go to school if they don't feel fully engaged. There may be other challenges like school avoidance related to bullying or a lack of a connection to a trusted adult in the school setting. And there's lots of misconceptions out there that I think hinder folks' ability to really feel like they understand why it matters to be in school. They feel like that's connected to their long-term goals. And again, I think as trusted folks in a young person and family's life, I think pediatricians can plug in for any of those buckets.
And what about an undiagnosed learning disability frustrating kids?
Absolutely. I mean, I think one of the things I think about a lot in my career in school health is even things as simple as a kid who needs a pair of glasses, who can't see, so then starts acting out. And then, the whole spiral begins.
Dr. Schumacher, could you tell me a bit about the program at the University of Vermont that works on school and health? And then we'll hear from Dr. Haag herself.
Yes, I would love to. So we, just as context, of course, Josh, you and I have worked together in a more urban setting in Washington, D.C., with lots of great work leveraging big data systems and really big infrastructures in an urban setting. And it's been really exciting now to be in Vermont, where we're really leveraging the assets of our small rural communities to say, how can we leverage those relationships, that deep intergenerational trust and community, to really move the needle on school attendance and engagement at a community level. So we were awarded a generous grant from the University of Vermont Leahy Institute for Rural Partnerships, which has allowed us to do work over the course of this year. We're about halfway through our time now, to first develop and test cross-sector infrastructures between healthcare and schools to really try to prevent and respond to chronic school absenteeism. That includes screening for missed school in the primary care setting, which Dr. Haag is doing incredible work with. We're also building awareness and readiness for action at the state level and really trying to lift up the lessons learned from our pilot communities and think about supporting state level structures within this work. And then the third thing, which I think is just as exciting for me, is we're engaging students, trainees in this work. Pediatric residents, pediatric inclined medical students, public health undergrad and graduate students, data science graduate students. So it's been really cool to think about building a culture in our trainees to really raise awareness about this work. And Dr. Haag is one of our pediatricians in one of our 4 rural pilot communities, and it's just an exemplar in this work on the ground.
All right, Dr. Haag, thank you for your patience. We built you up quite a bit at this point in the podcast. Thanks so much for joining us. Where are you today?
So at this moment, I'm home, but I practice in rural Vermont in Enosburg Falls with Monarch Maples Pediatrics. It's in the northwesternmost corner of the state, almost in Canada.
How long have you been out there practicing?
23 years.
I imagine by now you may be seeing some of the children of the first babies you took care of.
Yes, I am most definitely on my second generation.
Amazing. So tell me what this project means for you in your clinic.
Well, it means a lot of things to me, both personally and professionally, I have to say. My education as I was a first generation college student myself was extremely important to me. And so I really want that for my patients if they want that for themselves. And I see the benefits of not only education in general, but all of the other things that school has to offer children outside of just the classroom instruction. And so I feel like that is something that I want them to have access to.
So you signed up for this project, and how does that change your work in the clinic?
So we started by just taking a more active role in asking questions about school attendance as part of our general information gathering from patients. As you know, in pediatrics, we ask lots and lots of questions of families when they come in. We screen for social health needs. We screen for anxiety and depression. And now we're looking a little bit at attendance and being able to look at all of that information together to get a better picture of what's happening for families and what their concerns are.
So let's say I come to your clinic for the sake of argument. Let's say I'm a 3rd grader. And it turns out that when you ask my parents, they say, well, he a lot of times doesn't like to go to school, or we keep him home for this reason or that reason. What do you do then?
So we have a conversation around what are some of the difficulties about getting to school. And then we really try to focus on the ones that we have the ability to help with, such as chronic illness or mental health concerns, which are 2 of our, I would have to say, larger problems that come to light when people are expressing what keeps them out of school.
So which kinds of mental health concerns are the most common?
Primarily anxiety. There's a lot of anxiety about going to school, about interacting in school, about school performance. The fear of failure is real. The fear of making mistakes is real. And kids are just really stressed in general. And so being able to learn some strategies to help them with their morning routine, being able to help them with strategies, give them a person to maybe meet at the door so it's easier to go in, just general problem solving that helps them feel more successful.
What's your conversation like with the child's parents? Like if I were a parent now and you were expressing concern about this and wanting my real engagement to try to get over some of these hurdles, what would you say?
I think the most important thing is to meet them where they're at and try to really understand and approach with curiosity and figure out what are their interests in their child attending to school, what's important to them, and then just building on that, a strengths-based approach, and then identifying some of the things that are perhaps challenges to that process and working from there.
And have you had success in this program? Do you think it's helped you support families keep their kids in school?
I will have to say that it's been a learning curve for all of us. And I do feel like there have been some small wins since we started. I feel like we have a few families that are very motivated to start this next school year. We even have put together a couple of workshops that are coming up really soon where kids can do a make and take calming box. So very excited for that to come to fruition. Right now, we're just really focused on figuring out how to utilize some of the supports we have in our office to really assist families and take a deeper dive with this. And so any win is a good one.
I appreciate that you're getting started and you have a lot of enthusiasm. What is a make and take calming box?
Sure. So our counselor is basically putting together a workshop where parents and children together can come and they receive a pencil box, and there are a number of sensory activities and toys that they can place in their calming box. They can decorate their calming box, and that's just a tool that they can use either before school or during school when they're feeling a little bit anxious or worried in order to try to just center them and help them with their day. And for the parents, we have a number of handouts just talking a little bit about the benefit of routine and how important it is to get a good night's sleep, and perhaps identifying a couple of supports in the school, having a morning check-in with someone, just to give them some ideas for how to help that morning routine go a little bit more smoothly.
Thank you for explaining that. It really gives a tangible sense of how you're working with families to help their kids succeed in school. I want to turn back to you, Dr. Schumacher, as we've heard from Dr. Haag. You have pediatricians across Vermont doing this kind of work.
Well, first of all, I'll say Dr. Haag is being very humble right now because she's describing, I think, a sliver of the great work that they're doing, both within their practice at the individual and the community level, including really looking at data trends they're looking at odds ratios, comparing attendance screening results against other social drivers. I know, Dr. Haag, food security is another one that popped up in your data as a real connection point to absenteeism. So Dr. Haag's doing great work in her practice, but also I think in Dr. Haag's practice and the other communities across the state, they're really building integrated infrastructures with their school partners. Again, in many of these communities, the kids who go to one school, many of them go to the same doctor in that same town or the next town. And so these folks are really doing incredible intentional work to say build routines where a member of the healthcare team sits as part of the attendance team in the school district. So every time there's an attendance team meeting with appropriate consent, that healthcare provider or a member of their team is sitting in that space with them to really improve the coordination of care.
Let me ask Dr. Haag, what is your relationship with the schools in your community?
Yes. Well, we have always had a great relationship with our school nurses. That has always been a really fun part of my job. And one of the things that we had just done prior to this project that was a wonderful lead in to this project was identify a specific person in our office that is the point person or contact person for all of our providers when the school needs to contact one of us. So we have a nurse care coordinator who spends a lot of time working with the school and the school nurses in particular, and that's just been a really nice way to connect both teams.
Got it. So there's a question about it, why a child isn't going to school. Could it be a health issue? They know exactly who to call. And vice versa, you know you have a good point of contact in your office to reach out to the schools.
Yes.
Last question for you, Dr. Schumacher. We're talking about looking at the data to see what might be correlated with not going to school. We're talking about a new, more intense relationship between pediatric practices and the schools. And then we're talking about all the clinical care, all the discussions that we heard about from Dr. Haag, all the way up to the make and take calming box. So many little things. Does this add up to a public health approach to absenteeism? Are you thinking about absenteeism as a challenge for health that is broader than not only what teachers can do, but even individual clinic visits?
Yes. I mean, I love that question. And the answer is absolutely yes. We're really proud of our state government partners who have jumped in with both feet with us in this, saying, how can we elevate school attendance and chronic absence as indicators that not only matter for the school sector, the education sector, but chronic absence is now one of our metrics in our state health improvement plan. It's one of our Title V measures that we're looking at. Which is a public health measure. It's really trying to think about how can we leverage school attendance as a shared measure of success, of well-being. We have a state summit planned in November that's going to bring folks from not only the health and education sectors, but the business community, the faith-based community, really trying to lift up school attendance as something that matters to all of us and where we can all play a role. And I'm really optimistic that we're going to continue to see some nice momentum across the state.
Well, I hope that the rest of the country pays attention to Vermont. We know chronic absenteeism is a huge challenge nationally, and I want to thank both of you for your time today to explain all this to us.
Thanks so much, John.
Thank you so much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.